Welcome to Learn and Go with Laurie. I'm Laurie McCauley from Optimum Pet Vitality, and today I want to share with you a really cool research article I found. It's a meta-analysis looking at chronic joint pain. What's a meta-analysis? It's when they take a whole bunch of different research articles and they whittle them down to get the most important information that's consistent. So what did they look at? They looked at chronic joint pain in humans, so they were all human studies. And they said, okay, chronic joint pain is one of the most common causes of pain in humans, and the most prevalent cause of chronic joint pain is osteoarthritis. Now in humans, they found that it was mostly in the knees and back. Now, if I'm dealing with dogs and cats, I'd add elbows and hips, right? That's where we see it. They also found that this chronic joint pain was associated with musculoskeletal impairment. So in other words, if I have arthritis in my wrist and I'm not moving it, the muscles, tendons, and ligaments that support it and move it atrophy. I'm not moving it, right? That's what happens. So what happens there is that I'm not moving it. I also lose range of motion. If I'm losing range of motion, my joint can't extend and flex and extend and flex, so my muscles can't contract and contract and stretch and contract and stretch, so they atrophy. The cool part about it is they also found associated with this is inflammation specifically at the joint capsule, because that's the trick. That's where we come in. There was a link between the degradation in the joint and the inflammatory activity at the joint capsule. We can affect that. We know we can. Here's just a few studies looking at decreasing prostaglandins as well as COX-2, cyclooxygenase 2, which are two of the primary inflammatory mediators at the joint capsule. I could have listed more, but then the print would have been tiny. But there's lots of studies also looking at decreasing interleukin-1 and interleukin-6, which are more inflammatory mediators at the joint capsule, things we can affect and make the dog feel better and heal faster. So, does it have an effect on the patients? Yes, it does. They found that in the patients that had the right variables, and we'll talk about that in a minute, there was a significant decrease in the VAS, or visual analog scale, how much pain are you in, and a significant increase in the global health status. That's quality of life when we're talking about our pets. So what are the most important nuggets? What did we find? Well, they found that if the dose is too low, there was no difference in the placebo, right? We kind of know that. You don't give enough. But, ding, 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 really important, if they did not treat the joint capsule, there was no difference versus the placebo. I'll repeat that. If they didn't treat the joint capsule, there was no difference than the placebo. Now, let's look at the other way. If they went too high of a dose, they decreased pain, but they decreased fibroblast activity. We need the fibroblasts to heal, so we need to have the right dose, right? That makes sense. We don't want to go too high because we'd be stopping pain, but we're also decreasing healing. We don't want that to happen. So they found a link looking at reducing pain reducing pain associated specifically with decreasing inflammation at the joint capsule. We can do that. But we have to treat the joint capsule. Do you know what joint this is? It's the elbow of a dog. Why is this important? Look at that beautiful joint capsule. What's black? That's the area we can treat. Yet, most people I know, when they treat an elbow with laser, treat the medial and lateral aspect, not the cranial aspect. I want to show you how to treat all of it, all the joint capsules, so that you can have the most effect, optimum effect, when you're treating all of your patients with osteoarthritis and so much more. They also found that it's related to how much of the joint capsule you treat, as well as your penetration, or the distance between the skin or your laser and the joint capsule. Because different wavelengths have different amounts of penetration, which means it's going to change your dose. Let me put that another way. Depending upon what your wavelength is, you need a different dose. And remember, we can't go too low or too high to get optimum effect. So we have to have the right dose with each wavelength. Each wavelength is different. Here's just a quick study looking at one wavelength versus another, and it's 3 times more penetration. It's important. So there's a lot of information to give you, but I've got so much more. I'm going to give you a birthday present. Monday's my birthday. But I'm giving you the present. Monday night, I'm having a free webinar, and I'm inviting you. Come play. It's 45 minutes. It's at 8 o'clock Eastern Standard Time, 5 Pacific. 35 of that is me teaching you more so you can start treating your patients better as soon as you're done. And the last 10 minutes is me answering your questions. So you can think of questions you have, and I'm yours for 10 minutes. We'll go through questions, see what we can answer, and help you out. All right, I'm Laurie McCauley from Optimum Pet Vitality. I hope you had fun. I hope you learned something, and I'll see you Monday. If you don't show up, I'm going to cry. I'll miss you. But if you can't come, know that the recording will be available for 24 hours, so you can still at least come and learn, have fun. See you soon.